Hi, my name is Dr. Todd Austin from Austin Family Chiropractic in Verdon, Illinois. And today I would like to talk to you about cold laser therapy and the Lumacare Duo laser. So first of all, a little background on myself. I started learning about lasers back in 2004. I've been a chiropractor since 1993, but in 2004 I started learning about lasers because I was intrigued as far as how they could help with different things as far as knee pain, shoulder pain, and quite honestly at the time, being as my only tool was the chiropractic adjustment, if there was something going on in a shoulder or a knee that was ligamentous, muscular, I didn't really have an answer for it unless it was a joint issue. So I started learning about lasers in '04. I purchased my first set of lasers in '05. Since that time, I have used lasers in my clinic on a daily basis. I have performed over 35,000 laser treatments in the clinic in the last 16 and a half years. I also was the team chiropractor and cold laser therapist for a semi-pro football team for 5 years, back in 2011 through 2015. And I performed over 600 laser treatments on the sidelines with those players as well. So that's where I'm coming from. I've worked with a lot of different lasers over the years. I also have a cold laser consulting business on the side where I have trained other, mainly chiropractors, but some other massage therapists, acupuncturists, and even a few medical doctors and nurses about what lasers to get for clinical use and or at home use. About 3 months ago, a friend, a respected friend in the cold laser industry who I have known for 5 years, reached out to me and he said he'd like me to take a look at the Lumacare Duo laser. So I decided to take a look at that, and I have since been using that laser in my clinic. So for about 3 months now, I've been using that laser in my clinic, and I am very happy with the results. It's not the only laser I use. I have several lasers, but it is a laser that I have found useful for standalone treatments, as well as in some cases combined with the other lasers that I've been using for years. So let me first tell you how cold laser therapy works. Cold laser therapy, we use a specialized kind of light created by the laser diodes, and the light has a certain wavelength. And so this unit, the Lumacare Duo, has 3 different wavelengths. One of them is visible red LEDs, which is only going to get us about 2 millimeters depth of penetration. Then we have the 808 nanometer, which we would call very near infrared, and that is going to get us 2 centimeters depth of penetration, so a little less than an inch. And then we also have an ultra pulsed wavelength in that too, and that is going to get us a full 5 centimeters or 2 inches depth of penetration. So that's what we're looking at in this laser device. It combines 3 radiances of light. So the way cold laser therapy works is that we have specialized light photons, which are units of energy. Once they get inside the body, they can have a healing effect. So if we laser normal healthy cells, we simply give them more energy. If we laser unhealthy, abnormal, diseased, or damaged cells, which is typically why I'm lasering patients in my chiropractic clinic, then it's going to also give those cells more energy, but it's going to help with the healing process as well. And it's going to help, if we look at things from a musculoskeletal standpoint, which honestly most of what I do as a chiropractor with lasers would be musculoskeletal, or neuromusculoskeletal rather. What happens is we're going to help to reduce pain, swelling, edema, and inflammation with the cold laser therapy. If there's a range of motion issue, i.e. limited range of motion or flexibility, a lot of times after a laser treatment, we're going to help to increase that range of motion quicker if we use the laser versus if we had not used the lasers. And then other things we're looking at is it's going to minimize the episodes of re-injury. Let's say if we had an athlete who tweaks his hamstring halfway through the season every year, and he's done that like 4 seasons in a row. If we were able to work with this patient in the preseason before he tweaked his hamstring and identify the area where the scar tissue is, a lot of times we could go in there with the laser, we can work on that area in the preseason or in the off season, get those fibers to where they're functioning much better, where there's less scar tissue. So a lot of times lasers over time, not just one treatment, but over a period of 6 to 8 treatments, we are a lot of times able to reduce the amount of scar tissue that is ultimately present in an area. So that's how we help a lot of athletes. Those are just some of the few reasons that I love laser therapy so much. Cold laser therapy, why I've been practicing cold laser therapy for 16 and a half years, why I cannot imagine my life or my practice without cold lasers, because I also have cold lasers I use at home on my wife, my children, and our cats. So now I'd like to talk to you specifically about the Lumacare Duo. First, I'm going to put on my laser goggles. When I take the Duo out of the carrying case, it looks like this. It's folded up. You can open that up. It has 2 aperture heads. So we turn it on by pressing the red button. We've got 2 arrows. We have both arrows showing. I've got both of the aperture heads activated. When we turn the laser on, we can see that. So we can move these heads around depending on what we're going to be treating. If we're going to be treating, let's say, someone's low back pain, we want to laser both of their SI joints. We could put it on like that. If we were going to laser someone for a neck issue, we want to do both sides of their neck and the back. You do like this. If we weren't lasering someone for TMJ pain, we could do something like this. So just show you the many uses of the Lumacare laser. If we wanted to turn one head off and just use one, we could definitely do that as well. By pressing this button, we can actually change the time from 3 minutes to 5 minutes to 7 minutes. And there I've just got one head activated. We have a skin mode, which quite honestly I haven't really used in a chiropractic setting. We have a muscle mode, which I use a fair amount. And then the most common one that I use it for in a chiropractic clinic setting, because we're working with a lot of chronic pain, would be the joint mode. So at this point I just have the top aperture head on. And that's what that would look like, obviously. The Lumacare is a wonderful laser device that I have grown fond of in my clinic over the last 3 months. I use it sometimes as a standalone therapy, and sometimes I do combine it with other lasers that I've been using for years as well. So that is what I wanted to tell you about cold laser therapy and my newest laser at Austin Family Chiropractic, the Lumacare Duo. So thank you for watching. Have a terrific day and happy lasering.